we've seen a sharp increase in the number of COVID-19 cases in our island, with strong evidence of community transmission. So we now have 162 active cases and more than 1,700 people in self-isolation after being identified as direct contacts of positive cases. Analysis of recent cases supports our view that the virus is now present in pockets of the wider island community. And the age distribution of these cases, particularly amongst those aged 20 to 29, is consistent with the experience of our European neighbours, who saw a second wave begin with young adults during the summer. Compliance with public health guidance remains mixed. Now, we're really pleased to see more people wearing masks, but many also seem to regard other important safety measures, such as restricting numbers at gatherings, as purely optional. Recent hospitality spot checks conducted by the State of Jersey Police and the Honorary Police did find evidence of this. Contact tracing also found that parties were the root cause of some of our recent cases. And this evidence was presented to the competent authorities ministers at a meeting last Wednesday. And it clearly showed that without urgent and concerted action by all islanders now, we may be forced to implement short-term lockdown measures in early December. And these short-term measures could be longer-term, possibly extending into the Christmas period, if this situation isn't managed. Now, this is not what I want our island community to have to face. And earlier this month, we introduced our winter strategy to continue the suppression of COVID-19 in Jersey, while balancing the need to keep our children in school, our businesses open, and our island running as normally as possible. On the basis of case evidence, it is now clear that Jersey has entered an early warning phase, so we need additional action to target the virus and to implement stronger universal measures. So today, the Minister of Health and Social Services will be setting out the escalation measures that will come into effect over the coming days to prevent the continued spread of the virus. From next week, we'll also be working alongside the Youth Service and Office of the Children's Commissioner to launch a communication and engagement plan targeted specifically at young people, parents and carers. I'm not going to sugarcoat the problems that we face or what the evidence is telling us, or underplay the importance of personal responsibility for containing the spread of COVID-19. It is critical that we all take the measures outlined today with the utmost seriousness and understand the real risk of lockdown-style measures if we don't adhere to them. I'm also acutely aware of the need to address the economic impact that these additional measures will have, especially on the hospitality sector. The Treasury Minister and the Minister for Economic Development will shortly set out the details of a new package of support to protect island businesses during the winter. I'm now going to ask the Deputy Medical Officer for Health, Dr. Ivan Muscat, to provide an update on the position of STAC and the cases we've seen over the last 2 weeks. Ivan, I'll hand over to you.
Thank you, Chief Minister, Ministers. I would like to discuss why we need to do more than we're doing now in order to try to better suppress COVID activity. This slide shows the possible spectrum of COVID activity that we can see in Jersey. On the right-hand side of the graph of the slide are small numbers of cases and small clusters, and on the left-hand side here are large numbers, large island-wide outbreak, which is essentially an epidemic, a local epidemic of COVID. Small numbers of cases can be dealt with targeted responses. Large numbers of cases require a blanket island-wide response. Currently, we're somewhere in the middle, perhaps a bit more to the left than bang in the middle, with a number of cases occurring on a daily basis, many of unknown source, and an increasing number of clusters. So what does the data actually show us? Why can we say what we're saying? This is a rather busy slide, but if we go through it bit by bit, it will give us a clear picture of where we are currently. In dark blue are symptomatic cases, in light blue are asymptomatic cases on a 7-day rolling average to avoid jagged peaks and troughs. In red are calls to the helpline, with the solid red line indicating those calling with fever and the interrupted red line showing those calling with 2 or more symptoms. If we look to the right-hand side of the graph, we will see what we saw last winter, with most cases being symptomatic, largely because our testing capacity was limited and therefore focused on determining whether symptoms were due to COVID or not. We then went through a summer lull and entered into autumn with a much greater testing capacity. And that is reflected by the larger number of asymptomatic cases we are now picking up in light blue, which means that these people can be isolated and their direct contacts managed better to prevent onward transmission. The increased testing that is available to us, however, continues to elicit more and more cases. So although we are seeing more cases of COVID as a result of increased testing, we definitely have an increased number of COVID cases. We would not be picking up COVID cases by our testing if they were not there. We are ramping up further testing and have increased workforce surveillance over the last couple of weeks to try to pick up more asymptomatic individuals before they spread COVID further. But despite this increase in testing, our positivity rate has gone up. It has doubled over the last few weeks from 0.4% to 1%. Now that is a relatively low number compared with the 7% in the UK, the 20% in France, and the higher percentage in other countries. But it is still a doubling of our positivity rate. And of course, countries like the UK and Ireland did have a percentage positivity of about 1% at one point, quite early on, perhaps in July. But they have now ended up with a much higher positivity rate and, as you know, quite large outbreaks. We want to act now, while our positivity rate is around 1%, to avoid increasing our number of COVID cases. And when our positivity rate is low at around 1%, gives us a much better chance of achieving a useful and helpful result. But it is not just the number of cases going up that is a concern. It is also a change in the complexion of the cases that we're seeing. This graph shows a significant shift from the number of cases we picked up through arrivals testing, shown in the yellow-green over there, to non-arrival testing, shown in blue. These graphs also show a change in the complexion of cases. The number of cases due to unknown source has gone up significantly from September at 1 to 8 in October to 25 in November to date, and we're only halfway through November at the moment. The number of cases that have contacted the helpline seeking advice and asking whether they should have a COVID swab has also gone up significantly, as shown in the grey bars over here. The number of clusters has also gone up significantly, and it's gone up from 0 in September to 4 clusters in October, and something like 7 clusters to date in November. And the clusters in red are large clusters, and the number of large clusters is increasing. And of course, as a consequence of all this increased activity, the number of direct contact has gone up, the number of people in isolation has gone up, and about 10% of direct contacts will turn out to be positive. So where are we today? The 14-day rate per 100,000 population is about 105, or was on the 13th of November, and that is the red line over there. Significantly lower than the positivity rate in the UK, than the rate per 100,000 in 14 days in the UK, which stands at about 500, and just under 1,000 for France. This slide was put together before the weekend, and the number of current known active cases at that point was 152. It is now stands at about 162. 97% or thereabouts of the positive cases that are active are Jersey residents, and only some 28 or so were due to inbound travel. As we said in the previous slide, about 30 of the cases we saw, of the active cases we have in November, are of unknown source in the last 14 days, with about 1,600 direct contacts. We don't at the moment have any COVID cases in hospital as a result of COVID. I would like to ask you to help us with our fight against COVID by helping to reduce the size and frequency of gatherings, especially gatherings involving alcohol, where inhibitions are lost, physical distancing is forgotten, hygiene measures are forgotten. I would urge people to wear masks in enclosed public spaces. I would urge people to keep following the basic rules of hygiene, respiratory hygiene, hand hygiene, touch surface hygiene, and to maintain social distancing at always 1 meter and where possible 2 meters. If you need to self-isolate, please stick to the rules. Please self-isolate. Do not spread infection to other people. As I was saying earlier on, if you are a direct contact, there's a 10% chance or so of becoming positive, and you don't know when you're going to become positive. And of course, if you do have a customer-facing job, if you have a public-facing job, then you are included in workforce surveillance. Please take up the offer of a test. It is good for you, it is good for your family, and it is good for the community. Thank you.
Thank you, Ivan, for providing absolute clarity on the position of STAC and the risks we are facing as a community if we do not act now. In the light of the risks we face, ministers have agreed a series of 8 additional measures to those I set out when launching our winter strategy on the 2nd of November. Firstly, as was announced late last week, we will introduce triple testing at the border for arriving passengers. This will provide an increased chance of identifying COVID-19 infection, whilst also safely reducing the period of self-isolation for those travellers arriving from the highest risk countries and regions. The new regime introduces PCR tests for all arrivals from green, amber and red countries on days 0, 5 and 10. Those arriving from a green area must isolate until they receive a negative result from their day 0 test. Those arriving from an amber area must isolate until they receive a negative result from their day 5 test. and those arriving from a red area must isolate until they receive a negative result from their day 10 test. Secondly, in addition to current care home and visitor guidance, extra PCR testing will be available for named visitors of each care home resident on a schedule similar to that of staff. Regular testing will also be introduced for residents of all care homes. Thirdly, from Wednesday of this week, older school pupils in years 11, 12 and 13 will be asked to wear masks in the areas of their schools where mixing and social distancing is more difficult to manage. The risk of infection and transmission is greater for older teenagers, as recent cases have shown. The policy will include mask wearing in communal areas and on the school buses, as well as face visors for teaching staff. Most Year 12 and 13 students, as a result of recent case clusters, are currently being PCR tested. In addition, we'll also be testing all pupils in years 11, 12 and 13. And fourthly, we will be introducing a universal closing time of 10 p.m. in the hospitality sector, with patrons having to leave the premises by 8:30 p.m. at the latest. Ministers firmly believe that in the face of the current scenario, this is a proportionate response to the risk of transmission in some parts of the nighttime economy. Establishing a clear closing time across licensed premises in conjunction with reductions in larger gatherings and household mixing provides a consistent approach to the highest risk situations. Things like drinking alcohol, attending multiple venues, and drinking later into the evening. We need to ensure that people physically distance and follow public health advice whilst limiting the wider economic impact of closure. Fifth, we will be reducing the number of people allowed to attend large gatherings. Super-spreading clusters of COVID-19 almost always occur in poorly ventilated indoor environments, where many people congregate over time. In such high-risk situations, where large numbers of people may come into contact with an infected individual, the potential for a cluster of infection is increased. So from Wednesday, the maximum number of people able to attend informal gatherings, such as those in a private home, will be reduced from 20 to 10 people. Gatherings requiring an organiser to carry out a risk assessment are reduced from a maximum of 40 to 20 people. Restaurants will also be advised not to take table bookings of more than 10 unless they have a separate room or area for that number. And the number of people attending funerals will be reduced from 80 to 40 people. The restrictions on numbers attending outdoor events will not change at this time. Sixth, we will be exploring ways to provide economic incentives to support these public health measures, including additional funding for students returning to the island. Seventh, we will be continuing measures to support the approximately 3,000 people who are clinically assessed as at high risk. As numbers of community infections increase, so does the relative risk of this group. We will continue to promote a personalised, risk-based approach to the activities this group of islanders undertake outside of their homes. We are encouraging a balance of risk between the risk of infection and the impact that prolonged social isolation may have on the mental health, mobility, and general fitness of high-risk islanders. Finally, we are recruiting more staff to maximise our capacity for PCR testing and contact tracing, and to manage the surges in demand that we anticipate over the holiday period. We want to ensure that testing, contact tracing, and enforcement continue to be managed in the most effective way throughout the winter. These new measures provide the strong, multi-layered response that is necessary to stem the rise in infections while avoiding the immediate need for a lockdown. We will be setting out a clear timetable for the introduction of these measures over the coming days to allow businesses and islanders to prepare. I would encourage and ask all islanders to study the updated guidance that will be on gov.je this week and to follow those guidelines closely. And in closing, I want to announce that today I've lodged a set of regulations which will, if passed, enable the government to enforce mandatory COVID-19 requirements by law if it becomes necessary, and this includes wearing masks. It has always been and remains our hope that islanders will take sensible precautions to prevent the spread of COVID-19 among us. But these regulations will allow us to take the necessary steps to ensure that our community is protected. I'll now pass to Deputy Susie Pinel, the Minister for Treasury and Resources, who will discuss the Winter Economy Plan, which works hand in hand with the public health measures that we have just announced. Thank you. Thank you. May I just correct something I appear to have said and hadn't realised? I said in announcing the timings for licensed premises, I appear to have said 8:30. The timings are that serving alcohol will stop at 10, and the time at which everyone must leave licensed premises will be 10:30. Thank you. Thank you. Thank you for allowing me that correction.
Thank you, Richard. Throughout the pandemic, the government has looked to match any necessary health restrictions with appropriate financial support. Today, alongside my fellow ministers, I would like to announce our COVID-19 Winter Economy Plan. This has been developed to provide the right level of further economic intervention at the right stage in this ongoing pandemic. The original support package included the co-funded payroll scheme and the COVID-19 related emergency support scheme, the business disruption loan guarantee scheme, and deferrals of GST and social security payments. This support has been endorsed by the Fiscal Policy Panel as an appropriate response to the economic effects of the pandemic and for being sufficiently targeted, temporary, and timely to hit the right balance of government intervention. The Winter Economy Plan includes a revised payroll support scheme, but also sector-specific schemes aimed at supporting the significant fixed costs of those industries most severely impacted by the pandemic. Today, I can announce a scheme for visitor accommodation providers, which will support up to 80% of designated fixed costs, paid on a monthly basis in arrears. The scheme, which will go live to applicants on Monday, the 23rd of November, will cover the period from October 2020 to April 2021. This will ensure that Jersey maintains a quality and diverse selection of visitor accommodation to both leisure and business visitors. This is of critical importance for the 2021 tourism season and beyond. Guidance on this new scheme is now available on gov.je. The final details of a scheme for events, attractions, and other business most severely impacted by the pandemic will also be announced imminently. Overall, the new visitor accommodation scheme and co-funded payroll changes will cost more than £17 million in total. These schemes will go through to spring next year. Funding for 2021 depends on the government plan being approved. If further health measures have to be introduced in the critical weeks and months ahead, we will consider the parameters of our support measures and revise them where necessary. I'll now hand over to the Minister for Economic Development. Thank you.
Thank you, Susie. The consistent aim of the government's COVID response measures has been the preservation of lives and livelihoods. We have endeavoured to ensure businesses can continue operating despite the volatile, unpredictable trading conditions, so that islanders' jobs are protected. So far, the government's co-funded payroll scheme, which was introduced in March of this year, has been at the centre of our economic response to tackling COVID-19. At its peak, the co-funded payroll scheme was supporting more than 16,000 jobs and around 3,500 businesses. During the summer, we were planning for a gradual return to more normalised trading conditions and had planned to phase out the payroll support scheme on that basis. But as we are all aware, the situation in countries around the world and in the UK, and critically in Jersey, has deteriorated somewhat. This means that we now need to introduce further health measures to ensure the safety and well-being of all islanders. This will inevitably have an impact on our economy. And we've always said that we would provide appropriate financial support to the economy if the situation deteriorated, and we intend to keep doing just that. So I can reveal today that a new, more flexible version of the payroll scheme, providing further financial assistance in the next phase of wage subsidy paid to businesses based on the detriment they are suffering. This means that businesses who have been or more adversely affected by the pandemic will get a greater contribution to their payroll support. The contribution will be based on the level of detriment, plus 10%. So, for example, a business experiencing a 23% detriment, that's a 23% drop in trade on the same month the previous year, will receive that plus 10%, which is 33%. A business suffering 40% detriment will receive 50% payroll support, and so on. We will be holding the maximum subsidy at this stage per employee at 60%, which is up to £1,200 per employee per month. I can also guarantee that no business will receive less than they would have under the previous plans. And more detail and examples of how this will work is available on gov.je. And our standalone organisation, Jersey Business, will also continue to provide valuable assistance to businesses who wish to apply for the scheme. Finally, I would like to ask islanders to continue, wherever possible, to spend local and support businesses and help to protect islanders' jobs. I think it is important that we keep Jersey open. I very much hope we can continue to do that. There are no current plans for a lockdown, and I would like to keep it that way for the economic well-being of the island. Thank you. I'll now hand back to the Chief Minister.
Thanks, Lyndon. Right, so thanks to everybody, Ivan, Richard, Susie and Lyndon. And before we go to questions, I just want to emphasise the very real risk that we are currently facing. So it's no exaggeration to say that we are very much balanced on a knife edge. So these additional measures will allow us to continue enjoying the hard-earned freedoms that we have fought for in the face of a growing global pandemic. We can slow the spread of COVID-19 in our community if we work together. If we don't make wearing masks the norm, if we don't keep small social groups, if we don't observe social distancing, then these measures will fail. And if they fail, then we will have to seriously consider an imminent lockdown, whether for a short or an extended period. If this is likely to happen, then it will be announced by government in good time and across all media channels, so islanders have time to prepare. So please do not pay attention to rumours of lockdown on social media or circulated by WhatsApp groups. Instead, please follow government channels and mainstream media announcements. We do not know yet what the end of this year will bring. We are hopeful that the recently announced vaccine will begin to become available, and we are taking steps to ensure that this can be distributed across our community as quickly as possible and likely in the new year. Until that happens, and until we know how effective it will be, we must continue to protect one another as best we can. And we need to act now. Act responsibly and act together as a community. Thank you very much for listening. We'll take questions from the media. Now, so shall we go for Island first?
Thank you very much. Lots of people want to know now about Christmas. It's not that far away. We're now looking at a rule of 10 within private homes. It sounds unlikely that we're looking at easing restrictions before that point. Is it a fair assumption to assume that Christmas gatherings will certainly be no more than 10 people?
There's an if, I think, in there, and I think Ivan might want to touch on that in greater detail. And the if is, if we are serious and everybody as a community takes account of the measures we've announced today and the other measures that we've already announced, and the numbers start coming down, then you can judge it at that point. If the virus numbers still keep going up, despite the measures we've put in place, then the scenario you're outlining is probably best case scenario. So it's very much down to how we as a community act, and if we act responsibly, and if we can keep those numbers being suppressed, then we've got a fighting chance of having a decent Christmas. But if we don't, then we'll have to take other measures. Ivan, do you want to add to that at all?
I wholeheartedly agree. I think if the measures we take now have the desired effect, then we will be in a better position to enjoy a more normal Christmas. Not a normal Christmas perhaps, but a more normal Christmas than we would otherwise. But we need to act now, not just to contain the virus and prevent us going into more draconian measures, but to also stand a chance of getting a reasonable Christmas. And of course, gatherings at around Christmas time can be seen as one-off events. Christmas only happens once a year. So we can think about having 1, 2 or 3 gatherings over Christmas which are different to the gathering numbers we currently are talking about, if all goes well.
In terms of the number of 10 in private gatherings, I mean, there's scope for interpretation there. Can you spell out exactly what that means? Does it include children? Is it only adults? What does the number 10 look like?
10 people.
Including children?
They're people.
Great, thank you.
Thanks very much. Okay, Benwick.
Thank you, Chief Minister. Are these new measures a concession that the messages of your last press conference a couple of weeks ago didn't work and not enough people are following your advice? Is there an argument to lock down now and save Christmas and New Year, which would appear to make sense from both a mental health and an economic perspective?
I think that one of the messages we did put out is that if people didn't pay attention to the very strongly advised position, that stronger measures would have to come through, and that's where we are. We are seeing more people wearing masks, but we're also aware, as I've said in my earlier speech, that there's some parts of the community who still think that these are optional and don't apply to them. So, and as Richard has said already, the legislation is now lodged. Is either lodged or is about to be lodged, but it's happening today. And we we're in the process of requisitioning a special sitting of the states, which will be next Tuesday, which the intention, subject to the will of the states, is to debate that legislation then with the intention of bringing it in force. And that will then put us in a position where we are then in the ability to enforce the measures that we are talking about. And I think, so for the majority of the community, we are seeing people, we're seeing more masks, we're seeing that kind of behaviour that you want. But for the aspects of the community that we're not seeing, this is the concern we have. I think going into, we think it would be better to try and avoid a lockdown. That's always been the approach we've tried to take. And we're still in that view because it has consequences all the way through. And as we keep saying, it's always been about the balance of risks. And wider well-being, mental health, which you've alluded to, is still within that balance. You've got no guarantee that the lockdown will have the measures we seek to achieve, or rephrase that as quickly as one might like. But it is a risk. It's a measure that we have in hand. We'd have to think about exactly what that looks like. And if these measures, we don't see impacts coming through, then that still remains on the table. Ivan and Richard, perhaps, if you want to comment.
I think even if we did have a lockdown in the near future, to try to have as normal a Christmas as possible, we would need to be very careful over Christmas, because we would not want that the liberty of a normal Christmas in a COVID era to result in a sudden sharp rise in cases immediately after Christmas, with all the negative effects that would have on the health of individuals, on the economy of Jersey, and so on. So being careful even after a lockdown would be necessary. So being careful now makes sense within that context as well, because we will still need to be careful over Christmas.
Yeah, can I just add, referring to the slides that Dr. Muscat showed us, certainly he was showing us that there is a rise of infection, there's a rapidly changing situation, but we are still at a positivity rate of 1% in the island, whereas our neighbours have sometimes got that in double figures. So there is still time to turn this around without going into a full lockdown. We are not being advised to enter a lockdown period, because it is possible that these measures will work if islanders will observe them.
Part of all of this is about trying to look ahead 2, 3, 4 weeks and anticipate what could happen if you do nothing relative to where we are today. Okay, next question.
Perhaps one for the Acting Medical Officer of Health. A lot of people are referring to the fact there is no one in hospital at the moment, and there is a relatively small number of people needing to seek healthcare. Is that evidence that this second round of COVID is less virulent this time, and perhaps we don't need as many severe measures?
There is no evidence that the virus has become less virulent or has changed in any significant way to last winter, or that people and their behavior has changed. What has changed, however, is that we are able to test many more people now, and are therefore detecting more cases than we had done previously, and therefore are in a better position to advise isolation to prevent onward transmission, and to undertake contact tracing to capture those who would otherwise have passed the infection on inadvertently. So that is what has changed. The number of people we are picking up now, and therefore helping respond to the outbreak, to the pandemic, is better now than it was in the past.
So that's keeping them out of hospital?
All that is dampening down activity, but also by dint of the wide net that we are throwing, we are picking up more cases. So the graph that I showed with lots of blue bars in it reflects the wide net that we have thrown out to try to dampen down cases. But it also, by dint of actually throwing out that wide net, we are picking up more cases, and therefore dampening them down and so on. But if we do not ramp up our measures, we may very well see people going into hospital with COVID. So the sooner we act, not just in terms of test and tracing, but also in terms of our generic public health measures, and adhere to them, the more likely we are to have dampened COVID activity.
BBC, Charlotte?
I do just want to follow up on the rule of 10, if that's okay. It was mentioned that you will be encouraging restaurants not to take bookings of more than 10 people. What happens if they don't follow that guidance?
So that's what I said earlier. We're requisitioning a state sitting on for next Tuesday, at which point the legislation is being lodged today, if it hasn't already been done, and that will then give us the enforcement powers behind it, in which case there become legal consequences.
Okay, and also, what does it mean when someone tests positive for COVID and they're seeking healthcare? Is that someone that's coming through A&E?
I think, Ivan, do you want to go into the technicalities?
Someone who has developed symptoms and phoned the helpline to ask if those symptoms could perhaps relate to COVID and whether they should be tested. So that statistic is derived from individuals who have presented to healthcare most often through the helpline and have then gone on to have a positive test. Obviously, if an individual turns up in the emergency department with symptoms that may be due to COVID and they are tested and found positive, then that contributes to that statistic as well. But the bulk are the positive cases detected by the helpline.
Thank you. And are we expecting the urgent treatment centre to reopen? Just following on from that.
It depends very much on the numbers that we are seeing. And at the moment, the current system in the hospital is working well and will only change if it is necessary to change. Don't forget that we would like very much to continue to deliver the usual business as usual healthcare for as long as possible, so that doesn't get delayed yet again.
Okay, thank you.
Okay.
And
No,
sorry. But,
no, you've got other colleagues ahead of you who are
okay,
waiting
fine.
very patiently, I'm afraid. So, Tom, JP.
Good afternoon. We've heard today about the reduction in the numbers coming into Jersey, and looking at the airport today, there are 4 flights only coming in. Three of them from England. One is from Rennes, from France, where we've heard there's 10 times the number of active cases in France as there is in Jersey, nearly. Is this essential workers coming into the island? Will they be exempt from some of the isolation restrictions? And is that, most importantly, is that appropriate at this stage when we're having to all take additional measures against COVID-19?
Right, I suppose the short answer is I don't know the details of the Rennes flight. The longer answer is that I'm not aware, but I can comment on that, of any changes in the, essentially the arrangements that have been put in place for if they are deemed to be essential workers. And the point about that was that they were working in a bubble, and effectively, therefore, they were isolating within that bubble. And the medical advice had been given quite clearly as to how that was being managed. And my understanding is that I'm not aware that that's changed since we last agreed it back in the summer. The overall regime, though, if they're not essential workers, putting the essential worker side, I suppose, aside, anybody coming in, if they're coming from anywhere that is either green, amber, or red, the regime that is presently in force applies, and then it's about to go to the 0, 5, and 10. And obviously, the day 10 test is not something we've had previously, so it is a strengthening of the overall regime. Ivan, do you want to comment?
Thank you. The exemption for certain workers is very strictly regulated. It is not undertaken lightly, and it is an exemption in relation to work only. It is not an exemption in relation to activity outside work. So such individuals have to essentially isolate outside work in their accommodation. Food is delivered to them. They have to transport themselves within a bubble, not using public transport, to their place of work, and conversely to go back to their accommodation, and then only be permitted to leave that form of isolation once they have completed the regimen that applies at the time. And that regimen from this coming Friday will be testing at 0, 5 and 10 days. Now, the benefit of testing at 0, 5 and 10 days, in contradistinction to having if you're coming from a red zone, having a test at 0 and isolating for 14 days, is that you can detect people who have become positive during that isolation period, and therefore determine if they have had either because of their circumstance or inadvertently direct contacts during that period, and to chase those individuals up accordingly. Also, of course, it does mean that people can come out of isolation when they have their negative day 10 result, which will be on day 11 or thereabouts, and that shortens the degree of the period of isolation. It is just as effective in terms of preventing onward transmission of infection as 14 days of isolation if that's observed fully. But we now can capture any positives and follow up their contacts.
Okay, second question.
Yes, just wanted to touch on gatherings and what the impact is on team sports. I'm thinking of outdoor team sports such as football, indoors such as netball. Will those be able to continue?
If they are within the 40 rule, then outdoor gatherings which involve sport can go ahead. Clearly, one then needs to think about what about spectators? Well, that will add to the 40 potentially, and transmission within the spectator element of a sporting activity is well recognized, whether it's outdoor or indoor. So the rule of 40 as applied to sports will allow sports to continue, but not in exactly the same fashion as it has done in the past, largely because of the spectator element.
Okay.
Thank you.
Thanks. I know Kathy's got a couple of questions from 103.
Yes, 103 have asked, how is the hospitality curfew going to make a difference? Isn't there a risk that people will drink at homes or other people's homes rather than a pub, where rules can be enforced by staff?
I'll do the headline on that. I think it's going to be back to Ivan again, but that is one of the reasons that you're bringing the guidance around the gatherings and the informal gatherings, and why the legislation is going to be lodged as well. So by bringing people back to the kind of 10 to 10:30 slot, it's about reduction in consumption of alcohol within that kind of significant group sizes, and then also reducing the size of the gatherings to limit that and enforcing that through law. I'm being fairly simplistic. Ivan, do you want to cover that?
Thank you. It is recognised that the alcohol consumption does reduce adherence to public health measures as a whole, and if in large areas such as pubs and similar, then the risk of transmission, even though there is some distancing, is still quite high because it is an indoor public space. Ventilation is relatively poor, and people, whatever the closing times are, still go on to their friends' places to drink afterwards. So that does happen, but we would like people to understand that if that is going to happen, they need to stick to the gathering rules and not congregate in larger numbers indoors.
Richard, do you want to add?
Just to say that we've seen the evidence of other jurisdictions, haven't we, where large parties or gatherings in licensed premises in the night time do lead to infection spreading. So that is well evidenced, and there's no reason to believe that Jersey would be any different. So that is why this would be an effective measure. And the legislation that is to be lodged, if the States Assembly approve it, will allow private parties to be restricted to 10, maximum of 10, and if that rule is breached, then action can be taken and criminal sanctions applied. So I really want people to take this seriously. It's not something we'd always want to do, to try and cut down on people's fun if they want to drink late at night, but this is going to be an effective measure which will slow the spread of infection. Thank you.
Second question.
Second question from Channel 103. Which teachers are going to have to wear masks or visors? Is it just teachers of years 11 to 13 or all secondary school staff across all schools?
Secondary school staff.
Okay.
Thank you.
Right. Well, I think on the basis it's 5 to 1, we'll start drawing that to a close. I think just to really try and sum up, look, we're sending out yet again a stronger message. Legislation is imminent. But if we all work together, and if we act as a community as we have acted all the way through to date, then we can come through this together, and we can come through it in a good way. But it is around making wearing masks the norm inside, keeping small social groups, observing social distancing, and don't forget the usual of the good hand hygiene. Those messages have really not gone away, but we've been re-emphasising them all the way through since the end of August, and we're ramping it up yet again. We're seeing the numbers increase. We're seeing what's happening around our neighbouring jurisdictions. If we observe these measures, then actually we can come through winter quite well. But it's down to us as a community. On that note, thank you very much, and thank you for listening, and we'll draw that press conference to a close. I thank Ivan and Richard and Susie and Lyndon and everybody here and everybody online for listening. Thank you very much.